First impressions are important, and it all starts with your smile. Freedom Mini Dental Implants. Wouldn't it be nice to throw away your dentures in 2021? You can do just that. Dr. Regan Ackerman is here once again. Dr. Ackerman, Happy New Year.
Happy New Year. Feels good to say that.
You know, I bet your clients, I bet you get lots of cards and Christmas cards and New Year's cards and people, because what you do changes their life for the better. So you probably get a lot of people who absolutely love you.
It really does, especially around the holidays when a lot of people want to, enjoy all those good foods and sit around and eat and with family. And I think that's when they remember me is, oh, I don't have to use all that denture glue anymore, or I got rid of that denture. I can taste this, nice Christmas ham or steak or anything. So yeah, definitely.
So you touched upon that. So let's go into a little bit more detail. Okay, the advantages and disadvantages of Freedom Mini Dental Implants. First of all, I'm going to tell you there's no disadvantages. There's many advantages to throwing away your dentures. Okay, first of all, the one that's really obvious to me is the ill-fitting denture. The glue, and that's really important, isn't it? Do you have a lot of clients who come in and say, okay, first and foremost, I don't like wearing them at all?
Yes, yeah, that's probably one of the biggest things we do is people come in with regular dentures, they hate them, they're miserable. I tell people all the time, I can make you the best regular denture in the world, but you're still gonna hate it and be miserable because you're gonna have to use denture glue. So with the mini implants, we are able to get people out of denture glue. They can snap their denture in, wear it 24/7, and then they just have to remove it once a day and rinse and clean it, but no more denture glue. They can eat so much better. They have that confidence to know that their denture is not going to be flopping around. They know it's not going to be clicking. All those things that people that wear regular dentures struggle with. So I see that all the time, and that's probably one of the most popular things I do at my office.
A beautiful smile is a big bonus, but also the foods that you love. If you're a denture wearer, you know what I'm talking about. If you have to chew, or if it's hard or fibrous, then you're probably not able to enjoy it. And a lot of these foods, it's not just about the taste and how much you enjoy them. A lot of it is the nutrition involved, right?
Definitely, yeah. I have so many patients that are like pureeing their food or putting it in a blender. I actually just had a patient yesterday ask me, will my taste increase? Because right now, they're essentially eating the equivalent of baby food. And when you're able to eat foods in their natural way, and be able to bite into foods and chew them, it definitely increases your taste and your nutrition and your health overall.
Yeah, salad, steak.
Certainly, and it just gives you a wider range of foods to choose from, to be able to eat those carrots and, like you said, salads, and not have to puree your food. And a lot of those soft foods are kind of the sugary, unhealthy foods.
Dr. Ackerman, and I've talked a lot about, I've done my research here on your product. I've had you on often, and there really is no downside. It's less expensive than the old method, a lot less expensive. It is just as sturdy, just as durable. And as far as the options, there's a couple of here that we'll talk about. But I think the proof is in the pudding. Whenever you see before and after pictures, it's almost like I can detect now a genuine smile from a fake one.
Definitely.
When they're not happy with their smile.
Yes.
So introduce me to Jeff.
Yeah, Jeff, great guy. So he came to me like many people. He had done everything he could trying to save his teeth, and he came to me knowing he needed all his teeth taken out. They were breaking down, they were decayed, starting to get loose because of bone loss. So he knew he needed all his teeth taken out, and he wanted a better replacement option than just regular dentures. So we did Snap Indentures for him. And the thing I really kind of like and appreciated about Jeff is he wanted to improve his smile, but he wanted to keep it as natural, and he didn't want it to be a drastic change. So as you can see, he didn't pick the bright white teeth.
Yes.
He said, he wanted them to be still very natural, similar to what he had, but just an improvement. So he had the Snap Indenture, and that's just what I really appreciated about Jeff in his case. And as you can see, I think we definitely improved his smile. But not drastically, he's still Jeff. We didn't change anything, and it's,
And look how much more confident he looks. In the first one, it's like, okay, it's almost like, okay,
barely gonna
I'm about to get
smile.
arrested here on the left, and then on the right, it looks like a genuine smile. Jeff's a handsome dude, so that really did help. Let's talk a little bit about when I look at that smile there. Let's talk a little bit about. Can you imagine living the life of I can't take pictures with my family and friends because I feel awkward about my smile, or I just can't. I can't embrace that, and I can't understand about, because it's such a good, important part of life. Let's have some memories, right?
Yes, and a lot of people struggle with that, and it's unfortunate. They either put their hand over their mouth or they try to smile without showing their teeth. So it's really kind of fun part of my job to see the afters and patients telling me, I went to the wedding and smiled,
yes.
and or or a lot of people say their family members or their friends just say, you seem happier and you're smiling. And before, they may have just seemed kind of like an unhappy person because they were afraid to smile. You know, they were happy, but they just kind of were trying not to smile all the time.
And I think there's a misconception, because don't be embarrassed. A lot of people say, well, they just didn't take care of their teeth. A lot of it is genetic, and they've taken great care of their teeth. There's just nothing they can do. Right?
It is nothing to be ashamed of.
Right.
And I say that all, patients come in, and you can feel, they're a little ashamed or embarrassed. And I say, you are not the only one in this situation. So many people have spent countless hours in the dental chair trying to save their teeth, brushing their teeth, doing everything they could. Like you said, a lot of it can be genetics, so it's nothing to be embarrassed. It happens to the best of us.
It really does. Okay, now we saw Jeff's method, and you mentioned Snap Indentures, and I want to take a look at that model. But there's another way, too, where you can totally throw away your dentures, no plastic whatsoever in your mouth. First of all, let's show us Jeff's method, if you don't mind, because you have a couple of models here.
Certainly. So I'll show, this is our model of the Snap Indenture. So
it'll take a little, there we go. Yeah, we'll get it here.
We'll get a close-up of this.
All right.
Let's see.
It'll come. There we go.
There we go. Okay. So with the Snap Indenture, so imagine this is your mouth without teeth, okay? And these are the mini dental implants. And we just call them a mini implant because they're just a smaller diameter implant. So it's a lot less invasive than the surgical implant. And we'll get into that, but I don't have to have as much bone. I don't have to do sinus lifts, bone grafts, anything like that. When I place these implants, all I'm doing is a little local anesthetic, a little Novocaine, no sedation, don't have to put you to sleep. And the day I put the implants in, I will be able to put these attachments inside your denture, and then you leave that same day with the denture snapped on to the implants.
How solid is that?
So, I mean, it's, I have patients that have a hard time trying to pull it off sometimes. So it just snaps in and snaps out. No more denture glue. Like I said, the day I put the implants in, you'll leave with the denture snapped in. You don't have to wait another 3 to 6 months like you do with the surgical ones before you can use them. So that's a big advantage of the mini dental implant. So this is a Snap Indenture, which is a fantastic option to get rid of denture glue, have more confidence in wearing your denture, especially that lower denture. That's probably the most common one I do because it flops around, it won't stay in. So this really gives you a way to be able to chew and keep those dentures in.
Okay, now if you'd like to throw away your dentures totally, we're going to do that in the next segment. I want to show you. This is it's like having your third set of teeth. You have your baby teeth, you have your permanent teeth, and then if you need, you will have these, and there's no plastic. It's the way to go.
Right, with the permanent teeth. Yes, no plastic. Get rid of the denture completely. We always say it's kind of like getting your third set of teeth.
Yes, it is. Okay, now, if you have any questions, if you have any, maybe you're a little bit apprehensive, 571-5263. 571-5263, and you can talk to Dr. Regan Ackerman. Throw away the dentures. Be confident with your smile in 2021. We'll be right back on Wave 3 Listens. If you have a question about Freedom Mini Dental Implants, 571-5263. Call and talk to Dr. Regan Ackerman. I just found out something fascinating about Dr. Ackerman. Okay, I have to ask you. So, because you're in the medical field, you've already had your vaccine.
Yes.
So I have to ask, what was it like?
Yeah,
what was the process like?
It was great. I got it yesterday. I went to the Broadbent Arena for my vaccine, and I was super impressed. And all the volunteers and workers there were amazing. My appointment was at 4 o'clock. I was driving out of there at 4:30 with my vaccine. I was so impressed. Easy process. Didn't even have to get out of my car. Didn't really hurt that much. My arm's a little sore today, but no big deal. It's totally worth it to protect our patients, our family, our friends. So definitely worth it, and very impressed with the process.
Do you go back for another shot? When do you do that?
Yes, February 9th, I believe. Yeah.
Well, that's cool.
Yeah,
so have no fear, right?
Have no fear, and I just all the respect in the world to everyone working at Broadbent because they did a great job.
Well, you deserve it. I mean, you had to shut down like quickly, didn't you?
We were one of the first people to have to shut down. Understandably, we work in spit and saliva all day, so it was very nice and comforting to get the vaccine yesterday or start the process.
All right. Well, good. Now I feel a little better about it. Thank you for relieving the tension.
Certainly.
Okay. We talked about getting rid of your dentures totally. Okay. No plastic in your mouth whatsoever. whatsoever, your third set of teeth. Can you show us the model and how that works? And it's not invasive, it's just as simple, just a few more implants, right?
Certainly, yes. Just like you said, it's no more invasive, you know, placing the implants as I explained for the Snap Indenture, but with the permanent teeth, we just place more implants, you know, kind of depending on the size of your mouth.
So still just Novocaine?
Yep, just still local anesthetic, no sedation, no stitches, no incisions. You know, I don't even have to take people off of blood thinners when I place these implants. So same thing, you know, just gonna numb you up, place the implants, but the beauty of the permanent teeth is getting rid of that denture. So you can see I just have this bridge of teeth, no plastic, none of that pink stuff. And this gets cemented on to those implants, and it's permanently cemented. So you don't have to worry about taking it in and out.
You brush them like regular teeth.
Brush them like regular teeth. We give you a water pick just to keep everything clean. But then you absolutely have nothing on the roof of your mouth. You get to taste your food again. You don't have any of that plastic up here. You know, people complain about the bulkiness. So this is, you know, as you can see, just like, you know, getting your teeth back, your third set of teeth, and it's permanently cemented in. It does not come in and out. Like I said, you know, with the mini implants, we don't have to do bone grafts or sinus lifts. I don't have to have a lot of bone. I just have to have some bone compared to the traditional surgical implant. So this is a great way to get rid of that denture completely.
Dr. Ackerman, you helped me segue into my next question because Bob called and he wanted to know, he said, he's been told he doesn't have enough bone. So you do have a model here that I think shows exactly why this is different than the, you may have been told before, you go to your dentist, he sends you to an orthodontist, the orthodontist sends you to a surgeon, and they say you're going to have grafts, you're going to have sinus lifts. It's not that complex anymore.
Right, yes. So yeah, this model kind of shows exactly why. The little hole, that is the hole that I have to make to place an implant. Yeah, difficult to see. Versus the surgical traditional implant, you know, that's the size hole that they need or have to make. So you can see they have to have a lot more bone to place an implant. Versus the mini implant, like I said, I always say I don't have to have a lot of bone, I just have to have some bone. So that's a drastic difference there. And that's also why the mini implant, you know, can heal faster. We can snap the denture on the same day because we haven't disturbed the bone as much. You know, and to answer Bob's question too, the consultations at my office are free. All you have to do is call. It's no charge. And at that consultation, we'll take a 3D x-ray to confirm that you do have enough bone for the mini implants. So all you have to do is call and schedule a free consultation, and the consultation includes the 3D x-ray. We'll go over, you know, your options and cost and everything at the consultation. How
often does it happen that someone doesn't have enough bone? It's a lot more rare than the old traditional method.
Definitely more rare. I'd say 90 to 95% of the people that walk in my office for a consultation, I have an option for them. You know, whether it be the Snap Indenture or the permanent teeth, but they're usually a candidate for the mini implant in some fashion. So yeah, it's pretty rare that I have to tell somebody they're not a candidate.
My first question would be this, okay, as compared to the old traditional method, is this as durable? Is it as long lasting, or do you have to come in every month or so? How does that work?
Yeah, no, certainly it is. As you know, I bought the practice from Dr. Stroud, so I see his patients. He had been doing mini implants for 15 plus years. So I have patients that come in the office all the time that have had implants, you know, 15, 20 plus years.
So you don't need to come in.
It can be just as durable as the surgical ones, yes.
And now, I know what everyone's wondering. We get calls a lot, and that's okay. Everyone's on a budget. We understand that, but there's good news. When it comes to budget, I know it's hard to tell because everyone's different.
Yes.
But if you had to compare as the old traditional surgical method and this method, what's the cost?
It's usually about half to a third of the cost. You know, and I know we've talked a lot about replacing teeth if you're missing all your teeth, but we do just single teeth. We can replace 2 or 3 teeth. So, you know, if you're missing just the one tooth in the front or you have a partial, we can replace, you know, you don't have to have all your teeth taken out. So usually, you know, a surgical implant start to finish, and you're going to be going usually to, you know, an oral surgeon and then back to your general dentist, and it can be like a year or so process, and that can be about $5,000 plus just to replace one tooth. And the mini implant, you know, just for a single tooth is about half the cost of that.
In the order of importance, I'm just curious, or is it different with everyone? Is it more the physical appearance And, you know, and I understand that, being confident in their smile. Is it the foods that they miss? Does that depend on the age of the person? And maybe if they're in a happy marriage and, husband or wife loves them regardless?
It's kind of hard. Everyone's personality is different, because I have some people in there like, I just want teeth, I just want to smile again. I'd say majority, quite honestly, it's all about function. They want something that's going to stay in, that they can eat with. Of course, they want it to look good, and we all want everything to look good. But if you can't eat, and you can't keep your teeth in, it's all about functionality for sure.
All right, 571-5263. 571-5263. Give us a call if you have a question. There's your answer on the screen. Freedom Mini Dental Implants. We have the expertise of Dr. Regan Ackerman. Freedom Mini Dental Implants. If you're thinking about throwing away the dentures, if you have a loved one who would love to throw away their dentures, get rid of the glue, it's the answer. Okay, had a question about the Snap Indentures method. Okay, the one when you snap in the denture. Someone asked, can they use their old dentures? Can you put in, I guess, the hardware to make sure that those snap in? Does that work?
Yep, good question. So sometimes the answer is yes, sometimes the answer is no. I just have to see the denture and make sure there's enough kind of thickness to be able to put those housings in, but it definitely can be done, and I have done it before. The biggest thing is that you like the teeth and the looks of that denture. If you like everything about the denture, then yes, there is usually a way for us to make it work with the implants and be able to, and also save you some money and use your existing denture for sure.
Okay, 571-5263. Rose has joined us now. Rose, welcome to the show. Thank you for watching. You have a question for Dr. Ackerman.
Yes, I want to know if the mini implant procedure can be used to replace just one tooth.
Yes, certainly. Good question. And yeah, we have a model here that I will show for you, once we're done. But yes, it can be used to replace definitely one tooth. I help people all the time that are wearing what we call a flipper or a little partial. If you have one, because you probably hate it. But yes, we can replace, one tooth in the back, a molar. I'll call them your kind of big chewers. We can do one in the front. But yes, we can definitely use the mini implant to replace a single tooth.
Yeah, let's take a look at that if you don't mind. It could be a single, it can be two, really any number of teeth you can help.
Yes, yeah. So this one, so the first is, it just has that missing tooth in the front, which happens to some, baseball injury, sports injury, whatever it may be, you lost that front tooth. We're going to place the implant the exact same way, no incisions, no stitches. The day I put the implant in, you get to leave with a temporary tooth and get rid of that flipper or partial or whatever you may have been wearing. And then about 4 to 5 weeks later, you'll get the permanent tooth. So you don't have to wait another 3 to 6 months like you do with the surgical one. But once that implant's placed, then we have the nice pretty tooth, and then it gets cemented on to the implant, just like the, the full bridge was cemented on. This does not come in and out. And then as you can see, this is showing replacing 3 teeth in the back. So, if you have a partial or you're just missing those back teeth and you want something to chew with again, we can definitely do that. We just place, anywhere from 3 to 4 implants. And then we do have the teeth splinted together to add strength. And then they get cemented on to those implants permanently. So it does not come in and out of your mouth. You brush it just like you normally brush teeth, and you floss on the ends, and it's just, having your teeth back. I'll say, I did several of these on my mother-in-law, and when I did them, she was like, it's like I grew my teeth back.
There we go.
I thought that was a great comment and a great way to say it.
Exactly. All right, let's grab another phone call. Susan has joined us now. Susan, welcome in. You have a question for Dr. Ackerman.
Yes, I do. I was wondering, I've been without teeth for over 20 years now, and I need to see what would be a good idea for me to do.
Yes, so I've seen lots of people in your situation, and I know the biggest concern is probably if you have enough bone still left after being, missing your teeth for 20 years. So I would say your first steps, if you're interested in this, is definitely, making the phone call to set up the consultation, and then we would take that 3D x-ray to confirm that you have enough bone to be a candidate for the mini implants, and then we can go over all your options and cost, and we do have financing plans that we work with. So that would be your first step, but don't think this may not be for you just because you've been missing your teeth for 20 years. I've definitely helped people out that, have been missing their teeth for 20 years, struggling with dentures for 20 years, or they just gave up and not even been wearing dentures at all. So, don't get discouraged, and please give us a call and see if I can help you.
Yeah, thank you for the call. Let's take a look at Jeff again, before and after pictures. Now, Jeff had the Snap Indentures, and he wanted a more natural look. He wanted to stay close. You don't want that start. It's like getting a haircut or shaving your head one day. It's like, wow, what happened to you?
Right, and
He looks more like the happy Jeff.
Yeah, he didn't want the bright white teeth. He wanted to stay close to home, so to speak. What he had, and like I said, I think it's a great improvement on his smile. And he's got dentures that function, that he can keep in, that he's happy with.
So whether it be permanent teeth or Snap Indentures, give them a call today. The consultation is absolutely free. Dr. Ackerman, for you and your family, a great 2021. I always enjoy talking to you.
Thank you.
Like I said, if I can get a smile like yours, I'm in. Pull my teeth. I don't care. That's great. Again, Dr. Regan Ackerman with Freedom Mini Dental Implants, located on Dixie Highway. Give them a call today. The consultation is free.